Hi, everyone. Thank you so much to Dr. Collins and Dr. Dry for joining me for this short interview for the Journal of Clinical Pathology. I'm Lisa Zhang. I am on the social media board and editorial board for the Journal of Clinical Pathology, and I am also a pathologist at Mass General Hospital. I do GI pathology and cytopathology. And Dr. Sarah Dry is professor and chair of pathology at UCLA, and Dr. Laura Collins is professor at Harvard Medical School and vice chair of anatomic pathology at Beth Israel Deaconess Medical Center. So the reason that I am joined by them today is because they wrote a nice and thoughtful editorial in the Journal of Clinical Pathology recently regarding gender distribution in pathology journals and editorial boards, a call to action. And that was in response to another recently published study in the Journal of Clinical Pathology by Wen et al. With senior author Catriona Mackenzie from Australia discussing this topic. So I just want to start by giving a really brief summary of some of the main findings from that paper before jumping into thoughts from Dr. Dry and Dr. Collins. So essentially, that paper investigated the representation of women among paper authors and editorial boards in surgical pathology journals, and they looked at the percentages of female authors at 3 time points, 2002, 2011, and 2021. So trying to get a sense of trends over the past decades. And this also has sort of a focus on Australia, the United Kingdom, and the United States, and comparing that to gender distribution in the overall workforce. And so in general, they found that there has been an increase in the proportion of total women authors in the past 2 decades, from around 30% to over 40% now. However, the increase was bigger for first authors and middle authors, but kind of lagged behind for women senior authors, as well as women on editorial boards, which increased from around 18% to a little over 30%. So that's sort of the background of their findings, and we can jump to the thoughts of Dr. Dry and Dr. Collins here. I think maybe to start with, one interesting point is that perhaps also something that's encouraging is that there seems to have been a greater increase in the proportion of female representation in the past decade, as opposed to the relatively smaller increase seen between 2002 to 2011, possibly reflecting a greater emphasis on awareness of this issue in more recent years. So do you guys have any thoughts about that?
Yeah, go ahead, Laura.
Actually, I was going to let you kick off because you were the lead on the project. So why don't you start?
Yeah, thank you for that question, Lisa, and thank you for inviting us to be here today to talk about this really important topic. I would say that, yes, I feel that there have been societal changes, and I think that those societal changes have helped to increase more diverse gender representation in authorship on editorial boards as well. Obviously, we still have a long ways to go with our editors in chiefs. What has happened in the past decade, I think that sometimes these things happen so quickly and yet at the same time so gradually that we forget about these huge changes. And, we've had a lot more public conversations around diversity, equity, and inclusion. We've had a much broader societal recognition of ongoing biases. We've had public calls for change, such as seen in the Me Too and Black Lives Matter movements. And many of our institutions have developed new strategies and committees to increase diversity within our organizations. We've seen some of our professional societies also make a more formal commitment to increasing diversity and talking about it more openly about what they're doing to increase diversity in all forms, not just gender, but other forms like institutional representation, race, ethnicity, et cetera, et cetera. So I think that just as part of the societal conversation, we're all much more aware of this. And that's great, because one of the big barriers to making change is structural barriers. And a lot of the structural barriers within our society are influenced by subconscious biases. And so I think that the more that we talk about it, the more likely we are to recognize these and to do something about them.
I agree with all that. I think that's absolutely on point. We have had this gradual shift in the way we think about inclusivity and ensuring that there is diversity in leadership positions, and sort of equality starting, it tends to start at, university levels, right? Making sure we have equal distribution of gender in admission rates and things like that. And that sort of filters up, but we see attrition as there's sort of increasing seniority. And that's the piece of gender equity, I think, that we still have a long way to go with. And I think that having this sort of greater attention to gender equity and inclusivity in society then forces consciousness in our academic institutions and the changes that we've begun to see. I think it often falls on the shoulders of those who are underrepresented in medicine to sort of try and have their voices heard. I think that there is greater representation of women, so maybe it's a little bit easier for us to sort of step forward and do that. But as you'll see, it's women that are calling this out quite often. And I think we'd like to see our male colleagues join in, and certainly some of them are allies for sure. But I think that there still remain some biases that we need to draw people's consciousness toward, so that we can keep the momentum going in terms of the changes that we're beginning to see.
Yeah.
And Lisa, I'd also just like to say that, Laura and I wrote this editorial about gender diversity because the article was written about gender diversity. But our personal belief is that we should have representation and diversity in all areas. And we hope that what we are saying today and what we've said in our editorial about gender diversity is also, people consider that when they consider all different forms of diversity within our communities.
Right. Definitely very important to have all various forms of diversity that really will help our community really be stronger and more well-rounded.
Yeah, I mean, I think it introduces a lot more creativity and thinking, right? You bring people's different experiences, different perspectives, and it dissuades us from sort of a single-minded approach to things, or a narrow-minded approach to things, and broadens our outlook.
Yes, definitely. I wanted to ask you both a bit about your own experience, since you're both in sort of leadership positions in your pathology departments, and how it was for you for your career to get to this stage, and what factors really helped you get there.
Well, I think mentorship and sponsorship are incredibly important, right? So I think for young people underrepresented in medicine, I think it's really important to identify a mentor and then a sponsor. And a sponsor, as I'm sure you know, is somebody who really sort of promotes you. They're not just kind of mentoring you on your science and career, but more is putting your name forward for opportunities. So I think having people in leadership positions really advocate for their faculty who may not necessarily, for reasons of bias, are not necessarily considered. It's important that we in leadership roles are really advocating for everybody, but specifically for those, for women and others underrepresented in medicine. So I think that's been very important for me. And I think also, stepping forward for opportunities when they present themselves, and not shying away, I think is valuable as well. But again, that sort of requires sponsorship to have those opportunities be seen and shown to you.
Yeah, I would agree with Laura. For me, another very important factor was participating in the Executive Leadership in Academic Medicine program, also known as Elam, that's sponsored by Drexel University. So I was fortunate to be nominated for that program by UCLA when I was still an associate professor. And that program and the professional development experience that I gained as part of that really helped me to think more intentionally and have a better understanding of leadership, what leadership was looking for, and how I could contribute to that in a positive way, which was very helpful to me. It also helped me develop a community of women, and to develop a community of men and women who could help me in various steps of the journey. So all of that was very important.
Oh, that's very interesting. I was not even aware that there are programs like that to help foster leadership skills, which I think is really important. I think one thing especially that I've experienced in my own short career so far is the difficulty with finding time to develop other experiences because we have such heavy clinical service work that it's hard to have time or energy to devote to these things in addition to having the opportunity to do that.
Yeah, I mean, I think, and Sarah and I have talked about this in different sessions that we've done. It's sort of priorities change at different phases of life, right? So there may be periods of time where you could devote a little bit more attention to, developing your leadership skills or participating in a program such as Sarah mentioned. And there are actually plenty of them out there. So I think looking at those resources and maybe your institution has a list of them, that would be helpful. But recognizing also that there may be periods of time where you have to pull back, when you have young children or elderly parents and other things that, draw your attention away for some period of time, and to sort of be kind to yourself and recognize that that's okay, that you can come back to it. And I think that medical schools, in terms of the academic progress, are recognizing that people have periods of time where the rate of progress may be adjusted, and especially for women who still bear much of the responsibility of childcare and things like that. So, there is plenty of data that it takes longer for women to progress academically than men still. And so, I think not holding that against women in their careers is something that academic institutions need to recognize.
Yeah, and the other thing I would just say, Lisa, is that if you look around at the people who are most successful in any way that you want to identify success, people are successful because they're very intentional with how they spend their time. And they're very intentional with the activities that they choose to take on.
Mm-hmm.
And that's not to say that we should be selfish and only do things that are of interest to us. We're all members of a community. And in order to thrive as a community and thrive as departments and thrive as schools, sometimes we have to serve on a committee that may not have been our first choice, but it's important to the department or to the school. But you don't have to serve on 10 committees in the same year that are not your first choice. So I think that, learning how to say no gracefully and appropriately in order to be able to focus on other activities, and learning, just in yourself, not taking on new activities before you're finishing up some existing activities. Those are really important skills that can be a challenge for some, especially younger faculty, because they're so enthusiastic and they want to do so many things.
Yeah, that's really wonderful advice. I think especially for trainees, especially as well, to learn to say no to things. I think another thing that's challenging for junior faculty is, in addition to being enthusiastic, is kind of the fact that medicine still is a very hierarchical profession, the sort of fear of upsetting or burning bridges with more senior members. As a trainee, I was at one point told that I should never say no to any opportunities because that's what someone's offering me and I shouldn't upset them, things like that. So, but I think for everyone, obviously, their time is different, and it's very important to sort of set boundaries and decide what is important to spend our time on.
Yeah, and that's both where the art of negotiation and the art of communication come into play, Lisa. So I think that sometimes, first of all, those conversations are always difficult to have. But if we're going to be successful in our careers, we have to learn how to have those conversations with people, right? So we can't shy away from them. Sometimes it's helpful to practice those with people that you trust, especially with people who are a little bit more senior before you go into the conversation. Ask them to bring up some of the tough questions that you might have to face. Ask them to provide you with some coaching as to how you might respond to those questions. But part of that in terms of the communications, you can say things like, right now, I don't have a lot of bandwidth. And if I'm going to take on this project, I would want to be able to do the best job possible. And I just feel at this point, I can't do that for this project, So sometimes you can, push it back in order to help people reflect that what they want is somebody who's really going to be able to do the best job possible, and you may not be able to. You can also turn that kind of approach into a negotiation. if I had 5% less time on service or 10% less time on service, then I would have the time to fully devote. And I understand that may not be something that you can do for me right now, but that would free up enough time for me to be able to take on this important task.
That's wonderful, wonderful tips and suggestions. I think for a lot of people, including myself, we have a lot to learn about negotiation and just, I think, becoming braver at approaching it, because I think one of the other things that you mentioned in your editorial is that a lot of women who may actually already be qualified for certain positions or certain opportunities are really kind of discouraged by this very strong imposter syndrome that we have. And so I think there's a lot of that sort of is a barrier to us negotiating more for what we want.
And I think, one of the things that's obviously that's sort of something that we have to address within ourselves, but I think it's also important again for leadership to, as Sarah has been saying, to make sure that there is time given to these important tasks that you ask faculty to take on, right? So leadership can't just keep piling on the asks to junior faculty. There needs to be recognition that to do the job well, time needs to be devoted to that. And I think just returning to the editorial that we wrote, the editor-in-chief role, one of the big things is there is an increasing proportion of women who serve on editorial boards. You mentioned it's up to about 35% now, but that's still not 50%. And having people from among that 35% step forward to say, hey, I would be good at this, or I could, or I would be interested, or I'd like to learn more about being an editor-in-chief. There needs to be sort of, I think, a better pathway for that opportunity, as well as support from either the publisher, the journal, the chairs of departments and things like that. That's something that, again, Sarah and I have been discussing that, there needs to be time for the job to be done well.
Yeah, I actually wanted to ask a little bit about your experiences with editorial boards, because I am relatively new to Journal of Clinical Pathology. Was the first editorial board I was invited to be on because Dr. Deshpande was a mentor that I had worked with before. But I think even when I was asked, my first thought was, I don't know what it means to be on the editorial board. I've never had this experience before, and no one has told me what this responsibility involves or what I would be doing. So how have more women been invited to join editorial boards, and sort of like what has led to the slight increase in the number of women on editorial boards?
Yeah, well, I think it's probably multifactorial. One of the best ways to get on editorial boards is to be publishing in your field, right? And to be recognized as somebody who's an expert, a thought leader, right? So as we get more senior women authors on papers, hopefully we're going to also see that translate into more women on editorial boards. There's also certainly an element of who you know. And that's where I think questions about institutional diversity come into play. So, in the past, I think it was very common for us to look at people within our own institutions or people that we knew really well. And now I see that people are making more of an effort to look beyond their institutions and to think about, other people who are publishing who would be good fits, but who, just perhaps, if they're in a smaller institution, they just may not be thought of as often for these types of positions. Yeah, and I think that moving forward, that's one of those areas where very intentional thinking is going to be very important for our editorial boards, to make sure that we're getting enough diversity. Also, the conversations that you mentioned, in terms of imposter syndrome, I think it's important for chairs, for mentors, for sponsors, for allies to be talking to everyone, not just to women, but to women, to men, to people underrepresented in medicine, to make them believe that they can take on these roles successfully. We all as a community need to encourage each other. And hopefully we also are going to start putting into place some time limits, I think, on some of these positions, because I think that also is an important way that we get turnover, get more people to try it out, and then that builds on itself, right? So when you get people from new institutions or who've tried it out for a short while do it, and they start talking to other people about the fact that they can do it, that builds confidence in others and hopefully helps with some of that imposter syndrome.
That's great.
I think some journals have also developed sort of little toolkits for what it takes at least to kind of review articles and think about, how to approach reviewing an article, which is sort of the first step in being part of an editorial board, right? It's building that skill. So there are some tools out there like that.
Well, I want to also ask if there's any other things that either of you would like to mention or talk about.
I mean, really, I think the call was put into the editorial, right, to say we need to draw attention to this. We need to change our thinking. We need to give opportunities to women and others underrepresented in medicine, and to provide the support for them to succeed. So I think it's all about consciousness raising, and support, institutional support and leadership support for these important roles.
Yeah, and I would say all of us can play a role, no matter what our role is in the organization. So you're a junior faculty member, you can start talking with whoever you meet with regularly to talk about your progression, your career progression, to say, hey, I might be interested in being an editor someday of a journal, or on an editorial board. What would be the paths that I would take? Or to say, how can we encourage more women to be on these when you're on an editorial board, if you think that there aren't enough women, or there aren't enough people from certain areas of the country or certain institutions, or certain other underrepresented characteristics, how can we increase these? I think that all of us, if we continue to ask these questions politely, it helps to raise awareness, and it helps us to move forward.
That's wonderful. Well, thank you both so much for your time and for your thoughtful answers, and of course for bringing more attention to this issue that is very important to many of us, especially those of us who are starting our careers. And I hope that through this interview, we're also able to bring more awareness to it as well to the broader public who may not have access or a chance to have read these particular papers. So thank you both again very much.
Thank you, Lisa.
Bye, Lisa.
Bye.